Hi, this is Dr. Serena Satcher. I'm talking about stress this month. So the next question was, in what areas of life does stress occur? So stress often affects people's behavior, concentration, appetite, and sleep. And people who have more body awareness and have established habits of exercise recognize that they're better able to handle stress when they've been exercising regularly and when they're eating well. Stress affects our cortisol levels. Cortisol is a stress hormone that comes from the adrenal glands, and it's also made along with other hormones and other neurotransmitters in the adrenal glands. Cortisol is a fight or flight hormone, or it's a hormone that is stimulated by the sympathetic nervous system. Cortisol helps our liver to make blood sugar to supply the muscles in our brain, and it helps us hold on to sodium, which helps us increase our blood pressure, like if you have to run away from a bear. Cortisol also increases the appetite, and it's a driver behind stress eating. Cortisol stimulates us to eat more carbohydrates and salty foods. And it can be difficult to get the cortisol back into a normal rhythm if a person has a habit of staying in fight or flight. For instance, many of us get into fight or flight when we're driving in traffic or running to catch the bus, or we have chronically stressful situations that cause us to kind of spike that cortisol throughout the day. So, the stimulating effects of cortisol in the brain can make sleeping or falling asleep difficult and result in stress insomnia or problems falling asleep because of stress.